this fucking mess. And I'm like, dude, like no one's gonna be able to figure this out. So I packed like a week's worth of stuff, like all my catheters and my meds and laptop and charger, and like I just packed everything.
Yeah, it wasn't like last time where you got rushed to the hospital in an
Yeah.
ambulance. You were checking yourself in, so you were able to bring everything.
Clothes. Yeah, that's a pro tip I recommend to anyone. Especially if you're spinal cord injury, pack an entire trip's worth of stuff, and especially your catheters, because hospitals do not carry those things. They do not carry your caths. Like, you have to take your own.
Yeah, I was about to ask that. Like, wouldn't they like carry those?
It's a specialized piece of medical equipment, so not really.
But they have like generic catheters, probably.
They got the kind that they go in and they stay in, and then you're attached.
An indwelling catheter.
Yeah, indwelling catheter. Or they might have like a catheter kit, but it's not the one that you would use. Like it's a problem. Like they do not have urological supplies just like readily available.
I guess it kind of makes sense. It's probably very infrequent that someone needs like a very specific kind of catheter or
It's
whatever,
like
and they
someone
can't be
has,
expected
like,
to have everything or whatever.
Exactly, like a colostomy bag would be like another example, or if you have like anything that's like helps with your bodily functions or that's attached to your body, or like people that have like feeding tubes, like there's a lot of stuff that like they just don't regularly have.
Yeah.
They don't have like the exact things. So super pro tip is pack all your stuff. So I showered and I packed all my stuff because I knew once I got there I wasn't going to shower for a while. And they ran tests on my urine. They ran tests on my blood. They cultured my blood. They cultured my urine. Nothing.
What does cultured mean?
Culture means where they basically put it in a petri dish and let it grow and see if any bacteria grows.
Gotcha.
So the urine came back clear, no infection. The blood came back clean, no infections in the blood, like no white blood cell count, like nothing. Like they were all like, well, everything shows that you're not sick, but you have this fever, so you are. And, I kept telling them, I'm like, yeah, I just got out of this, like, got hit by a car 5 weeks ago or 6 weeks ago, and my leg.
Yeah, and it's funny because the doctors come in there like, you're in here because you got hit by a car, right? And it was like, yeah, but no.
I'm like, no, I'm in here for a fever that I can't figure out. And they're like, oh, well, you got hit by a car? Is that how you got your spinal cord injury? And I'm like, no. Yeah.
There's like 5 major events you have to explain to them.
There's so many times. And also doctors are like the worst with ableist language. Like there's so many times it's like, oh, is that how you got confined to the wheelchair? Like, oh, is that how you were wheelchair bound? Like or to be like, oh, is that how you got your quadriplegia? I'm like, I'm not a quad. No. There was only one nurse that knew what was up. And one time a doctor came in to talk to me, and the nurse was like, that's irrelevant to this current stay. You don't need to ask him about that. She's like, but he has paraplegia. He needs to be treated. She goes, no, he doesn't. He's here because of a reason that I'm going to tell you guys in a second. She's like, not because of his paraplegia. So stop asking him about that. She's like, it's inappropriate. Like the nurse was like on my side. It was pretty cool. And so we like kept trying to figure out what the hell. So eventually they like put me in this like decision unit or whatever, because like they couldn't figure me out in the emergency room, and I still kept having fevers and kept having fevers and kept having fevers, and like they kept running tests and would give me scans and x-rays and checks and just everything, and they couldn't figure it out. So it kind of got to the point I'm like, okay, well, what's the one thing that's changed since, and it was the leg. I'm like, okay, so can we start running some like scans in the leg? Can we like figure out why it's like, maybe the swelling hasn't gone down, or like why it hurts? And they're like, okay, sure. So they did some they scanned for blood clots, which are also known as DVTs. Don't know what DVT stands for, but so they like.
It's a devotee.
Yeah. So I'll
look it up.
The lady who was like doing my sonogram or whatever, like anyone who's gotten a sonogram before, they just look, through, they just put the jelly on you and they scan you. And then as they're scanning you, they'll like make little clicks to like mark like important images. They'll like take photos and then they'll write notes on the photos. And she just kept clicking and kept making notes and kept clicking and kept making notes. And I was like, oh fuck. I was like, I know what this means. She's like, and we need to check your other side just to make sure that, there's a variance between the two, for whatever. And then she kept like clicking, and she like went all the way up to my abdomen and like all the way down to my toes. And she was like going beyond like looking at my hips and all this stuff. And I'm like, oh geez, like there's something big going on here. Like this is a problem. And so then I was diagnosed with what the vascular doctor considered like one of the more extreme blood clots he's seen. He called it extensive.
DVT, by the way, is, oh my God, I just forgot it. Deep vein thrombosis.
There you go, a deep vein thrombosis. And
it's when you're playing the trombone in a deep vein.
Yeah.
A deep vein thrombosis.
Thrombosis. And so I kept having these like wicked fevers, and he's like, yeah, it's pretty extensive. We're going to have to operate on it. We're going to have to do a thrombectomy. We're going to go in through the back of your leg and, kind of suck out all that's there. And, I've got a filter that was put into my body, which basically keeps any blood clots from breaking loose and like shooting up into my lungs or into my brain.
That's convenient.
Yeah,
that you had that.
They put it in there for this exact purpose, because a lot of people with spinal cord injuries get blood clots.
And probably wouldn't ever notice them because they don't have sensation and all that kind of thing.
You notice them when they get hot and swollen. Like there's another guy named, I won't say his name, but anyway, he was saying his legs got so swollen he couldn't even fit in his wheelchair anymore.
Holy shit.
Like that's how he knew he needed to go to the doctor, because they were just so big he couldn't fit in his own wheelchair anymore.
Wow.
But so they put me like on like these heavy duty hardcore blood thinners, like in an IV drip, where they had to like make sure that I weighed the exact amount, and every time they tested my blood, they had to make sure that like my blood levels were the same, and then they would adjust it, to like fit the exact, thing every couple of hours. It was pretty serious, because like I could have started just bleeding internally or bleeding at my Blaine, or
your Blaine?
My Blaine. My David Blaine.
I could have started bleeding in my Blaine.
Bleeding in the Blaine. And then it was like, okay, so we're doing this surgery, and then like it's we're gonna do it tomorrow. And then
so don't eat for the whole day.
And then
and Andrew brings the wrong ham.
I asked Andrew to bring me a literal like entire ham and some pickles, and he brings like 4 ounces of diced ham that was like in a bag in the door of my refrigerator. Like,
by the way, it was right next to the giant hunk of ham. Like the hunk of ham was in the door, and the little baggie of ham was in the door, and there was a thing of pickles.
Richard wants a snack, not he's gonna eat this is his final meal for the next 24 hours.
Because that same day, I think that was the day that I brought you Chipotle, and then I thought someone had also brought you dinner.
No, that was
the last meal was the Chipotle. So then you were like, yeah, bring me some ham and some pickles. And I was also bringing you some other stuff from here. And so I was thinking like, oh, he just wants like a little snack or whatever. Because I was
little snack.
I wasn't realizing you were like, this is the last time I'm able to eat. Bring me a giant fucking hunk of ham. Like I just saw the ham was like already diced up in a little baggie. I'm like, oh, that ham.
Yup. Anyway, so they come in at like 3:00 the next day, and the vascular doctor was like, all right, we can't operate on you. It's too extensive.
And wasn't that when they realized it was in both legs too?
Yeah, and that's what he's like, yeah, it's not just in your left leg, it's all the way up to your hip. In your left leg, it crosses over to the hip into your right leg. He goes, and it goes all the way up into your abdomen. He goes, and it's entangled inside of the filter. He's like, I
didn't even know that.
He goes, yeah. He's like, the filter is the only reason you're alive. He's like, or this blood clot would have like kept going and killed you. And
Holy
I was
shit.
like, oh, cool, great, nice, wonderful.
Where is the filter? Where does it sit?
It's the middle of my chest, abdomen somewhere.
Below the heart somewhere.
Yeah, below the heart.
But is it on the vein side where it's coming back to the heart?
It's an IVC filter, and IVC stands for something.
Intravenous.
I think it's the particular vein. It's like there's 2 veins, one that like goes like away from your heart, and then one that goes into your heart.
I think the vein is the one that goes into your heart, and the other the artery is the thing that goes away.
Okay.
I could be wrong about that, but I think veins are blue because it's the bad blood that's coming back to your heart.
I don't recall, but that sounds correct.
Yeah, I don't know.
That sounds correct. It was in the big tubes.
One of the big fat tubes.
And he also said, he goes, yeah, this is actually not a new clot. This is a chronic one. He goes, this has been inside of you for years. He's like, we can tell because a lot of it is calcified, because they did like a CT scan. He's like, a lot of it is calcified. He goes, your veins or your smaller veins or the
little arteries that like branch off the main tree.
Yeah, he goes, they have taken over the job. He's like, we can't find a pulse in your foot, but your foot is full of blood and it's warm, so that means that the veins have remapped. And he goes, and that doesn't happen overnight. He goes, that takes years. to happen.
So basically the main tree trunk had gotten so stopped up that the roots were like taking over the main job.
Yeah, exactly.
It's crazy.
Yeah, and he goes, and your right leg isn't showing any symptoms. He's like, and that's the side we'd have to go into. He's like, and this isn't no little machine. He's like, it's the size of my pinky.
It's going into a vein that's probably
and it's going
a couple of millimeters.
And it's going to just like, grind everything up and suck it out. And he's like, we can't go in and around your filter because that would mess it up too. He's like, it's too extensive to operate on. He's like, and I make my money doing this. He's like, I would make money
doing the surgery.
Operate on you. He's like, but if you were my family member, I would tell you don't operate on it. We just need to put you on like high dose blood thinners and get you like at a therapeutic level. And then over time, years, it'll, slowly kind of absorb back into the body, and, your veins and your arteries will kind of just do what they're already starting to do. And, you'll pretty much, have to be on blood thinners for the rest of your life because clearly you have a problem with chronic clotting and you didn't even know about it. And I'm like, cool. So basically I had this thing in me for the past who knows how many years with no symptoms, that whenever I got hit by the car and the trauma happened to the leg
and the rest of your body, to be frank.
Well, yeah, and the rest of my body, because the rest of my body did get jacked up, and my right wrist, along with there's a lot of other things.
There was a lot of recovery that needed to happen everywhere, and probably that meant lots of extra blood shit.
Yeah, being moved around, but basically like the tibia getting smashed, and then all the trauma. And if you guys remember from the recovery vlog video, how bruised the back of my legs were, and how inflamed it was. So like all this blood was pooling in my legs, and it had nowhere to go because the big tubes couldn't suck and blow all the blood in and out of the system. It was a mess. So some of them were new clots, but a lot of them are old clots, and it was so extensive. So like I'm sitting there going,
it's almost kind of like a parallel with a spinal cord injury. It's like, when you have an incomplete spinal cord injury, like all this, there's big signal from the top trying to get down to the bottom, and it's just trickling real small.
Mm-hmm. Yeah. And it was just kind of one of those things where I'm sitting here like, okay, so we know what's causing the fever is the blood clots. We can't operate on it. So what do we do? Because I'm still having fevers.
Right. And they're kind of just like, well, we can't do anything, so see ya.
Yeah, they're like, well, you got to just start taking blood thinners. And I'm like, yeah, I know that. But like, I still, like the original problem why I came in
I'm still
here,
running fevers and I'm still having giant pain attacks. So yeah, what the fuck?
Like
I can't just live.
Like, it's like clockwork, like every 4 hours, like da 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 da. Like I got so in tune that one time my temperature was only 0.1 degree higher than it normally is. And I like hit up the nurse and I was like, hey, I got a fever now. And she was like, took my vitals, and she was like, yep, you are 0.1 degree. And I'm like, cool, can I have Tylenol now? And she's like, no, it's not actually a fever. So we
could just be an anomaly.
She's like, so we can't medicate you. And I'm like, give me medicine now, please. I'm like, I'm going to suffer. I was like, because it takes 30 minutes to kick in. I was like, this is what's going to happen. Over the next 30 minutes, I'm going to go up 2 more degrees. Watch, it's going to happen. And then you're going to take my temperature again. I'm going to be at 101. And then you're going to give me the Tylenol. And then by the time the Tylenol kicks in, I'm going to be at 102. And then it's going to slowly start trickling its way down. And then I just spent an hour and a half in extreme pain, headache, backache, neck ache, nausea, sweating, like pain, just because you can't give me something right now. Please give it to me. Like, oh, sorry, we can't do it. Like, it was just like.
And sure enough.
That's exactly what happened. Like, there was one point where, like, I went 2 days without a fever, and like one of the doctors came in. I was like, all right, you're good to go. No more fevers. And I'm like, it's because I've been medicated. I'm like, it's because I'm staying on top of having Tylenol in my system. And they're like, oh, well, all right, we're just going to take all your Tylenol away and see if you still have fevers. And sure shit, kept having fevers. And it was just so annoying, man. There was so many things that like kept going wrong.
The main thing that was just ridiculous. Number one, this hospital was way better than the last hospital. Let's get that straight for sure.
I would mark this one a 9 out of 10 compared to the 3 out of 10. Yeah, that the previous hospital.
And we even talked to a nurse that said that she worked at that other one for a little bit,
and she said she had to get out because it was so toxic.
Yeah,
she's like, I could. She's
like, it wasn't just us.
She's like, yeah, I felt like I was a good nurse and that I had a duty to like help these patients that really needed it because it's like a really hard facility and a lot of really hard nurses. She's like, but after a while, I realized that little old me couldn't do enough to save the place, so I just had to go because it was too toxic.
Yeah, literally. And it's like, jeez.
Yeah. It's
Even
like,
the nurses, and that's why probably all the nurses there suck because all the good ones end up leaving because they can't stand it.
yeah. It's like same thing with like my
You gotta burn the place to the ground and start over.
my primary care physician did his residency there, and he apologized to me. He's like, "I'm sorry you had to go there." He's like, "I was there for 3 years, and it was a hell of an experience."
Yeah, I bet.
He goes,
3 freaking years.
I mean, residencies are a long time.
Mm-hmm.
I
I know, but that would suck.
Yeah. So anyway, we're at this point where I'm like, okay, so I get sent home with fevers then, I guess. And
Cool. That's why I came in here. Cool.
yeah, so that's what it is. Is like I'm still at night getting fevers. I take Advil right before I go to bed. You know, I turn my air down, but I still wake up in a puddle of sweat, and I'm like, cool, this is great. You know, here's another thing is like that annoys the shit out of me about a lot of medical professionals, nurses especially, don't understand spinal cord injury at all.
And especially yours, which is kind of like a unique kind where it's like, wait, you're in a wheelchair. Wait, you can walk a little bit. Wait, what the heck? Like it's just confusing.
No, but I mean simple things like bowel, bladder,
Yeah,
skin
yeah.
care, like those type of things. Like it was to the point where they like put some like TED hose on me, which is like a compression stocking, and
It goes all the way up to your crotch,
yeah, it goes-
basically.
and then overnight it like gave me a skin sore and like ripped off a part of my skin because I was doing my skin checks the next morning and I was like, what the fuck is this? And I had this like quarter sized like skin rip.
On the side of you.
Yeah, and I was like, what the fuck? Like I was like, I can't what? And I was like, why did they put these on me? What the hell? Like I was so annoyed because I didn't know.
You texted us and you were just like, cool.
Dude, I was so like there was so many things that kept going not right, and I kept feeling really defeated, and I felt like no one was listening to me, and I felt like they just wanted to kick me out even though I was still miserable and sick. It was just like this big mess of a deal. And again, not talking trash on the hospital. Hospital's great, but it just is like I'm probably on the side of the physicians because like look at the empirical data. You know, if I were to look at my chart and read it and be like, yeah, it's time for him to go. But like it wasn't time for me to go.
Yeah.
And it was just annoying, man. It, like wound care came in and they looked at it and they were like, I'm shocked that this happened to you. Like no one should have ever put those things on you. Let me see them. No. And like even the like vascular doctor was like, oh, these are crap. No one should have ever put these on you. Like you need to get like nicer ones. And he like suggested which kind I get. He's like, and it shouldn't have gone that high. And I'm sorry. It literally happened in 8 hours. In 8 hours, I had a rip of my, like a quarter size rip of my
It
skin.
was like raw skin.
And then had like blisters everywhere. And like, so the wound care guy came in and like.
Also, the best was they didn't want you to wear pants and stuff. Remember when you were like, when I got there and you were like, dude, they won't let me put on pants.
Yeah.
You were just hanging out with like your dick out.
Yeah, because they kept having to come like look at my leg and like touch my leg. So every time I put on my socks and put on my pants, they'd come in and be like, "All right, take off your socks and your pants." So they'd take off my socks and my pants and be like, "All right, we'll be right back." And like 30 minutes later, they wouldn't be back. So I'm like, "Okay, I'm freezing." So I'd put my socks and my pants back on. They'd come back in 30, 45 minutes later and be like, "All right, let's see your socks and your pants." And then they eventually got to the point like, "Quit putting your pants on." And I'm like, "Quit telling me you're gonna be back in a minute."
Bring me a blanket.
Like I'm freezing, dude. It was,
The best was when you had those white compression sock things on,
Uh-huh.
but no underwear. So it looked like
Yeah.
you had pants, but you could just like lift up your shirt and fucking calf.
That was
There's just dick there.
dick right there.
And wasn't there something in the beginning when you were like naked in the hallway and there was just people like walking past or something in the very beginning?
It's one of the things that annoys me the most about like being in hospital sometimes is when they knock, they're not waiting for you to say, "Come in."
They're just letting you know they're
just
coming
like,
in.
They're like, "Hey, we're about to barge in here." So I could be in the middle of like peeing or doing a bowel program or just sitting there naked, and some doctor would just knock and walk in and just start talking to me with my balls out, like with my finger up my butt, and I'm like, "Is this can I have like 5 seconds of consent?" You know?
Right.
There was also so many times when I'd like go to like X-ray or like get a CT scan or something where like people would just like walk behind me and be like, "Where are your push handles?" And I'm like, "Why are you walking behind me? Like, don't push me. Like, look at this wheelchair for 5 seconds and look, it's not one that you can push." Like I'd be like talking to me like, "All right, so we're going to X-ray." I'm like, "Okay, cool." And they'd start to walk behind me. So I'd like turn to be like, "I guess we're going this way." And they would like spin around in a circle. I'm like, "What are you doing? What are you doing? What are you doing?" They're like, "Oh, I'm trying to grab you to push you." I'm like, "I'll follow you." Like, clearly I can propel this on my own. Like, it's down a long hallway. It's far. And I'm like, don't worry. I pushed a 10K recently. Like, I'm fine. Like, Jesus. Yeah.
It's a long hallway.
Also, they were so like,
That's funny.
didn't believe me when I'm like, oh, no, I can transfer. I'm fine. And they're like, oh, you sure you don't need any help? You need assistance? I'm like, no, I can transfer. Thank you. They're like, all right, well, be careful. We got to do it. Like, leave me alone. Like, at one point, they were like, you need to put on our anti-slip socks. And I'm like, yeah. So in case I don't slip and fall when I'm walking. I'm like, your socks suck. Your hospital socks are suck.
No, they pointed at your socks. They're like, you should be wearing our socks. And
They
you're
go-
like, oh, those are my socks. And they're like, are they anti-slip?
They're
You're like, no.
No. And they're like, you need to put on some anti-slips. And I was like, yeah, for when
You
I'm
just
walking.
look at them. For when I'm walking. You're the idiot, not me. Don't forget that.
Don't forget it. Hope you enjoyed that clip. If you want the full episode, you can click right here. If you want to subscribe, click here. If you want more clips, we got 2 more right over here.